What does a cavity look like? 5 cavity symptoms you should never ignore. Ever had a weird pain in one of your teeth, and thought, oh no, does this mean I have a cavity? Of course, only a dentist can tell you for sure, but there are plenty of signs, both visual and physical, that can help you identify whether you're dealing with a cavity or possibly something else. But first, what even is a cavity? A cavity is really a hole in your tooth from tooth decay. Sounds scary, but they're relatively easy to treat with a dental restoration procedure, fillings, crowns, etc. There's also plenty you can do to prevent cavities. So what are the symptoms of a cavity? These are the 5 signs you should look out for, along with photos to help you spot potential cavities yourself. If you feel or see any of these things, you should get to the dentist as soon as possible, to figure out what's going on, and get treatment. 1. You have a toothache. Cavities are most often caused by acid damage. This acid is usually created when oral bacteria ferment carbohydrates from the food we eat. This fermentation creates acid. Acid can break down your tooth's enamel over time, causing overall weakness and, worst of all, cavities. This deterioration process can be physically painful, so if you've got a toothache seemingly out of nowhere, it may be a cavity developing. 2. Your teeth are super sensitive. If you naturally have sensitive teeth, this may not be new to you. But if you develop sensitivity to hot, cold, or sweet foods that you didn't have before, you may be feeling the effects of a cavity. Because cavities start on the outer part of your enamel, and there are no nerve endings in the enamel, it's hard to tell early on. But if cavities are ignored long enough, you'll definitely be able to tell if one has developed. As it starts progressing to the deeper layer of the tooth, and it hits what's called the dentin, that's where things start to get sensitive. Sensitivity equals cavity progression. And it's not just food that can lead to weak enamel and cavity development. There are other things, like medication, that you could be taking that could cause dry mouth, which creates a perfect environment for bacteria to run wild, and that can also cause decay and deterioration. 3. Your teeth are very discolored. Tooth decay leads to discoloration, so a change in shades, or one particularly dark area on a white tooth, is not a good sign. 4. You see black spots or holes in your teeth. Cavities start out white, then you'll see black spots, or holes in your teeth. If you're seeing either of these things, it means your cavity is progressing, and you should schedule a visit to your dentist, so they can deal with it before it gets any worse. 5. You feel pain while eating. The holes that form from cavities can even go all the way down to the soft tissue in the center of your tooth. At this point, a cavity will hurt a lot, especially when it gets pushed down on while eating. How can I prevent cavities? There's a reason you were told to brush twice a day as a kid. But too many people are skipping it at night. Your saliva is protective. It helps to neutralize what's in your mouth as a normal, washing away process. But when you go to sleep, this process dramatically decreases, giving all the bacteria in your mouth time to do some serious damage. But just brushing is not enough. You have to floss too. With brushing, you'll miss 30% of what's on your teeth. There are also a few adjustments you can make during your meals to reduce acid buildup. For example, drink with a straw. Straws are great because they will help things pass over your teeth. And if you are going to drink wine, soda, acidic things, follow it up with water so it doesn't stay on your teeth the whole time. And if you chew gum, buy some that contains xylitol. It's in a lot of sugarless chewing gum, and it helps prevent the growth of the bacteria that cause cavities. Don't forget to check the link in the description below. You will learn about a weird bubblegum that claims to rebuild gums overnight. Michael Myers, a 45-year-old father of 3, was close to giving up. He had struggled with tooth and gum decay for more than 6 years. He'd tried everything, but nothing worked. Until he found this odd bubblegum in one of his son's drawers, and after chewing it, his gums were rebuilt overnight. He also managed to get rid of his chronic bad breath. You can see it for yourself, just click the link in the description below, and find out how you can fix your dental problems overnight. If you watched the whole thing, and are glad you did, hit the like button, and don't forget to subscribe to this channel. Liking the video supports the channel, and lets us know that you guys are enjoying things around here. Thank you so much for watching. See you in the next video.